This past year, Walmart experienced one of the worst failures in its entire history. And it came out of nowhere. Because over the last century, Walmart has become one of the largest and most successful companies in the world. Historically, when it makes a public goal, it is almost always successful in following through and achieving that goal. Look at its supercenters, Walmart Plus, or even its more recent drone delivery program. So back in 2018, when Walmart announced one of its most ambitious goals yet, many people thought that it could finally fix one of the most broken industries in America. And it looked like Walmart was well on its way. It was able to implement new technologies and artificial intelligence way before some of the existing competitors could. But last year, Walmart gave up, just quit and moved on. And in this video, we'll take a look at what really happened with Walmart Health and the behind the scenes internal plan that Walmart had for it that makes this failure so much more painful. Let's dive in. While Walmart has dabbled in healthcare over the last few decades, pharmacies, eye centers, even a generic $4 prescription program, in 2018 it publicly announced a much bigger goal: to become America's neighborhood health destination. Internally, they outlined plans to build 4,000 clinics by 2029. And they got out of the gate fast. They spent billions on full-size medical centers right next to their supercenters. These offered primary care, dental cleanings, x-rays, therapy, vision exams, meaning Walmart was hiring actual medical doctors, nurses, and dentists. Physician salaries even averaged around $240,000 a year. Despite all those salaries, Walmart was clear that they were going to continue to serve their same core customer, somebody who's price sensitive, maybe uninsured, and often underserved. So they posted prices up front. Doctor visits would be $40. Dental cleanings were going to be $25, and therapy was $1 a minute. That's incredibly cheap. For reference, the average primary care visit is $461 with insurance. Walmart's model literally cost a tenth of that, and you didn't even need insurance. The first clinics opened up in Georgia, and they reported very positive initial findings. I mean, they're not going to say our opening was horrible, but they had a higher number of patients than they expected. Plus a 40% cost savings, mostly from eliminating what they called administrative baloney. And Walmart scaled quickly. New clinics in Florida, Arkansas, Illinois, Texas. But stepping back for a second, many experts were actually hopeful that Walmart could fix American healthcare. Many of the same people had given up on the US healthcare system fixing itself from within. So when a retail giant with trillions in revenue, infrastructure, and data said it wanted to take on healthcare, the idea really didn't sound that bad. But what few people outside of Walmart realized is that Walmart had its own personal and pressing reasons to enter healthcare, reasons that had nothing to do with fixing the entire system. Publicly, Walmart said that they wanted to make healthcare accessible for underserved communities. But internally, Walmart had another goal, one that they didn't really talk about. As the largest private employer in the United States, Walmart was getting crushed by healthcare costs. With over 1.5 million employees and 170,000 who are eligible for benefits at their company, and many more dependents on those plans, Walmart had to spend hundreds of millions of dollars every single year to give its employees insurance. And Walmart self-insures, meaning that they pay out their employees' claims out of their own pocket. And with how much it costs for medical care nowadays, this has been a major financial strain on Walmart's books. So when Walmart launched full-service clinics, they knew they could double this as a way to make their employees more healthy and to also lower their healthcare costs. Instead of $40 for a primary care visit, Walmart charged employees just $4 for a checkup. And when it rolled out virtual care in 2021, employees got access to it for free. The idea was if Walmart could get an employee to do virtual care with them and avoid an unnecessary trip to the emergency room, they could save a couple hundred or even $1,000. Multiply that by 100,000 plus employees on their plan, and that's going to really add up. So Walmart didn't just need Walmart Health to work out to increase its number of customers, it needed it to work out to reduce its own healthcare costs. But in April of 2024, Walmart abruptly announced it'd be closing all Walmart Health clinics and its virtual care platform. It came as a surprise to many, but not a complete shock. I mean, based off their initial projections of having 4,000 clinics by 2029, they should have had at least 1,000 by 2024. They only had 51. And Walmart Health failed for 3 reasons. Number 1, internal chaos. The original champion behind the clinics, Walmart US CEO Greg Foran, left the company just months after the first location opened. His replacement, John Furner, didn't seem nearly as excited. Insiders say he quietly shifted focus back to e-commerce and tech at the same time that Walmart Health lost its biggest internal supporter. And then the exits just piled on. Sean Slavinsky, the exec who built the health strategy, left in 2020. Then most of the original team. By 2021, at least 8 top leaders were gone. One former employee said there's no restated strategy yet, which is just corporate speak for this thing is dead. Reason number 2, high costs. Just as Walmart launched its clinics, the US experienced one of the worst doctor shortages in recent history. Meaning hospitals, health systems, and of course Walmart would need to pay big money to not lose their doctors. And while $240,000 a year isn't a small amount of money for a primary care doctor, other health systems could simply pay more. But to make matters worse, each clinic needed to buy a ton of expensive equipment, maintain labs, and hire a whole team around those doctors. It's a lot of money to get those clinics started, and and when your plan is to build over 4,000 of them, that's multiple billions just to get this thing going. And the third reason Walmart Health failed was low reimbursements. Many patients drawn to Walmart Health were on Medicare or Medicaid or had no insurance whatsoever. These were precisely the groups that Walmart promised to help with affordability. However, public insurance like Medicare and Medicaid reimburses providers at significantly lower rates than private insurance. What's that mean? Well, for most health systems or healthcare providers, they can handle losing money from programs like Medicare or Medicaid because they can make it up in other ways, usually by charging health insurance companies high prices. But in Walmart's largely rural and low-income clinic locations, a significant portion of their patients were on government paid plans, making the economies impossible to sustain. In fact, in all of healthcare, primary care, which is what Walmart was doing primarily, is actually a loss leader, which just means that whenever you go for your yearly checkup, the hospital probably loses money on you. But it's worth it for healthcare systems to lose that money because by getting people in their doors, they can offset those losses through specialty high-cost treatments, think surgeries or some big procedure. But Walmart didn't offer any of those high-cost services, so really they would need to offset costs by acquiring a ton of new customers through Walmart Health or by saving a ton of money on their employees' healthcare costs. Neither of those things was happening fast enough for Walmart executives. But my personal question is, did they think it would after only 5 years? That's hardly enough time for Walmart to give their healthcare efforts a fair chance and to gain real brand recognition in healthcare. My personal suspicion is Walmart saw how messy healthcare is firsthand and decided that the minimal and distant profits that they were projected to get in the future were simply not worth all the trouble. If you found this video interesting and you'd like to see more like it in the future, please consider following for more. This is Tyler Dutchover. Thanks for watching.